So the decision that the MRC and the Wellcome Trust made to fund UK Biobank, to put really substantial investment into establishing it and maintaining it at this scale and with this depth of information about the participants, was on the basis that the data would be widely used. So they made the decision that we should build the UK Biobank resource so it would be used by as many researchers as possible.
Our job is just to build the resource, and it's for the research community to actually use it to improve public health.
One of the beauties of the biobank is at inception it was envisaged as something that would be made available to others. And that's, so in a way, it's obviously important. You know, you can't have every researcher deciding they're going to set up a study of 500,000 people and study them longitudinally. Plus the fact, many people have different questions. So the beauty of doing this study and then giving access to academics and industry across the world is you'll have people asking questions that the originators would never have thought of. You're going to have people asking their own important questions, maximising the value of what's been collected and coming up with surprising, unexpected answers. It's been very open and created a new form of open collaboration, which has been really managed extremely well, which has meant people have collaborated who never otherwise would have thought to do so.
To say we're going to build this infrastructure, these train tracks really, and you can run whichever train you want on them. And we will provide that facility, and we'll do it in as open and transparent and free way as possible, and the value will be in it being open.
So I do think Biobank has been one of those types of collaborations that has led the way for how you can work across public and private, across government funded and private funded, across large and small, and across borders.
Cohorts of 500,000 people with a ton of phenotype information do not appear on a regular basis, right? Like, these are unusual things, and as is important to remember, they are not typically as accessible and as shared for the furthering of science internationally as they are in the context of UK Biobank. And I think that's just a real testament to the importance of science and driving the science as a core value.
It was a lot of things that had to align, I think, for UK Biobank to exist at the scale that it does and to invite as many people as it does to collaborate on the data. And to me, that was really the biggest thing. There are other countries and other large biobanks, but the level of sharing data with collaborators around the world, to me, is unprecedented.
I think UK Biobank is an astonishing accomplishment. The way that it has been set up with open access allows a global reach that very few other data sets allows today. And it's imperative to have this type of data sets, both for research and biomedical insights, but also for training and education.